Penetrating injuries such as gunshot wounds or knife stabbings can be life-threatening and require immediate action. Knowing how to assess and provide first aid for these injuries can make a critical difference. In this video, we're going to guide you through the assessment and initial treatment of penetrating injuries. But before we begin, it's essential to remember that first aid is not a substitute for professional medical care. In the case of penetrating injuries, it's vital to call emergency services immediately. Your main goal is to provide initial care and support until medical help arrives. Let's look at the steps to assess and provide first aid treatment for penetrating injuries such as gunshot wounds, or in this case, a nail gun injury. First, ensure the scene is safe. Carefully assess the scene for any ongoing danger and ensure your safety and the safety of others before approaching the injured person. If there is an active threat, prioritize your safety and seek a safe location before providing aid. Your safety and the safety of others is always the most important step. Secondly, call for help. Dial emergency services or ask someone like you in the plaid shirt, call 911. Provide accurate details about the situation, including your location and the nature of the injury. Calling for professional medical help is crucial for the injured person's survival. Third, control the bleeding. Apply direct pressure to the wound using a clean cloth, a sterile dressing, or even your gloved hand. It's always recommended that you utilize universal precautions. Maintain pressure until medical professionals take over. If the object causing the penetration is still in the wound, don't remove it, as it may be acting as a plug to control the bleeding. If you believe there's a possibility that the penetrating item, such as a bullet, knife, or other item, may have gone through the body, check to see if there's a wound where the object came out, especially with bullets, as the exit wound is usually larger. Controlling bleeding is of utmost importance. Apply firm and continuous pressure to the wound. Treating the wound with a dressing and bandage will help the clot to form and stop the bleeding. Fourth, positioning and maintaining body temperature. Once the bleeding is controlled, help the victim to a comfortable position, preferably lying flat on the ground. Then, cover the injured person with a blanket or any available material to help maintain body heat. This can reduce the risk of hypothermia, help with the clotting process, and provide comfort to the victim. Lastly, provide reassurance. Keep the injured person calm and reassure them that help is on the way. It's important not to lie to them or give them false hope, but minimizing their movement to avoid exacerbating the injury, keeping them calm and reassuring them that you're taking good care of them can all aid in their recovery. Do not probe or irrigate the wound. Inserting objects or attempting to clean the wound extensively can cause further damage or introduce infection. It's important to resist the urge to probe or irrigate the wound. Our focus should be on controlling bleeding, keeping them warm, providing assurance, and awaiting professional medical help. Remember, in most cases, maintaining airway, breathing, circulation is the most important steps in a critical emergency like this. These are basic steps to provide initial care for a penetrating injury. Once emergency medical services arrive, they'll take over and provide that appropriate treatment.